No, let's talk about this actually. So, a surveyor that has affiliations with the ASA went in and then wrongly accused this hospital in California of having CRNAs that are operating outside of their scope. They're operating within their scope. California is an opt out state. CRNAs can operate completely independently. Because of people with opinions like this and politics like this, over 1,000 surgeries have been canceled, harming patients. This hospital was specifically picked and targeted because the hospital doesn't have a ton of money to pay for a lawsuit. So, because physicians want control of all of the anesthesia political world, now patients are suffering because they are like shutting down hospitals unnecessarily. This is not a sentiment that's shared by all physicians by any means. However, this sort of sentiment is like a prime example of how politics and healthcare and just like people wanting to be right and wanting to have power is not in alignment with what's good for patients. But to follow this through, it's first of all, it's not a ban on CRNAs in California. It was a wrongly interpreted site visit that shut down surgeries and is harming a community. But let's hypothetically say that all CRNAs are banned in the United States. You know, we deliver over 50% of the anesthesia in the US, right? We're just gonna stop doing surgery. Patients are gonna stop receiving care because you want like to be the top dog. Also, the average physician anesthesiologist and the average CRNA is over the age of 50. Like, there's not enough people who work in the field of anesthesia at all. But yeah, this is just kind of an example of how nasty people are, and they are not prioritizing patient care. This is only about their ego. This is a prime example of what people deal with in the day in and day out. And it really just shows their true colors. Like, you don't care about patients, you don't care about safety, you don't care about patient outcomes. Anyway, yikes.